Case 3 is a common plantar heel pain presentation, with risk factors including sporting and activity demands, foot type, and sport-specific footwear. Patient 3 is a female footballer with mildly pronated feet and plantar heel pain. This is a very common presentation. She is 35 years old and around 68 kilos. She has an active lifestyle and plays football twice a week plus training. She's a flexible, pronated foot and passes the lunge and jacks test for sagittal plane function. Her heel has been painful for 2 months since the start of the football season, and it's also causing pain into the medial arch. It's worse in the morning after matches and even when she stops for half time during the games. She has had the team physio strap her arches before the games, which also seems to help. Let's go through the pathway for orthotic prescription. Step 1. Let's pick the DOLA Pro style for this patient. The DOLA Pro Fit has been specifically designed for harder to fit footwear, especially football boots. It has a much lower profile than the DOLA Pro and fits into football boots without the need for any further adjustment or grinding. Step 2. Let's look at a foot type to see what prescription we need to add to the DOLA Pro Fit shell. The fully reinforced medial arch support of the DOLA Pro Fit will reduce the load and strain on the fascia during loading, stance and propulsion, especially in the pronated foot. And with a mildly pronated foot type, we're looking to increase the dose and amount of medial orthotic reaction force. To do this, we'll grind in extra rear foot varus or medial control. The grind will keep the rear foot post thicker on the medial side to tilt the foot outwards and support the pronated foot. The flat plantar surface of the DOLA Pro Fit allows fast and easy modification of rear foot control. Step 3. Now we need to look at the pathology or tissue stress and see if there's any further prescription required there. With plantar fasciitis and medial arch strain, we'll look to further reduce the load and strain on the fascia and the medial arch. To do this, we'll increase the dose in the midfoot area by adding more medial arch support with a 5mm Poron arch pad. Step 4. Due to the sport-specific footwear, we need a really thin, strong, durable top cover with added cushioning. We've gone for an EVA top cover in 2mm, as the 3mm option will take up too much space in the boots. The aim of this orthotic is to provide a moderate dose of medial orthotic reaction force, with cushioning and a hard-wearing top cover, whilst being able to fit nicely into a football boot. So let's take a look at how we're going to make this in clinic. So the first step is to grind in the rear foot varus post. This is just where we're just grinding nice and flat on the bottom surface, but keeping it thicker on that medial side to provide that medial orthotic reaction force. So you can check this as you're going just to make sure that's nice and even, but one of the really key features of that stable flat plantar surface of the DOLA Pro range is being able to grind in that rear foot post nice and easily. Next step is we're going to put on the medial arch pad. So this is just a pour-on self-adhesive arch pad using the 3M tape again. We're just going to mark off where at the position of that on the medial arch. Most of the time you're just going to put it more centrally in the arch, but obviously you can put that a bit more proximal or a bit more distal if you want to move the pressure or the support point to suit your patient. So depending on their foot type, their morphology, things like that. So once that's adhered onto the top surface through there, now we're just going to add the glue. So this is just the contact adhesive again. So we're just going to spread that nice and evenly across the EVA top cover and of course on the dorsal surface of the orthotic and across the top of the arch pad as well. Just going to let that dry for a little bit, then activate it with the heat gun again. Once again, when we're placing this EVA top cover across the top of the DOLA Pro Fit shell, just going to move from the distal direction back into the proximal direction, nice and even, nice and slow. There's no rush here, and we're just going to pull it nicely around the heel cup just to make that nice finish for them. We're just going to trim that just to save a little bit of time on the grinder, and then it's off to the grinder for some finishings. So just doing our final grind here, we're just making the EVA top cover nice and smooth around the surface of the DOLA Pro Fit just to get a really nice finish, and then we're just going to place it into the bottom of the football boot.